Muli ho nagbabalik ang inyong programang Aksyon Central Luzon Special Edition. Ito pa rin po si Sunny Lopez. Kasama ko si Dr. Rowie at saka ko si Dr. Maria Paz Irene Bautista. Ang haba ng pangalan ni Doktora. Anyway, kanina meron akong nakabinbin na question before the break. Pero before that, si Dr. Rowie naman, meron siyang gustong ipasok. A very interesting part of the discussion po ito, mga kaibigan. Dr. Rowie.
Kasi we just want to ask, Doktora, yung mga common myths, yung mga ano yung mga nasa utak ng mga tao, common people na about autism, no? So, na take it from the expert kung ano sasagutin niya. So, the first one that we really want to know is yung, sabi nila autistic people daw are all alike. Kung napanood nila yung Rain Man na si Dustin Hoffman, kasama si Tom Cruise. So, yun na yung autistic. So, alam na nila kung sino yung autistic. Totoo ba yun, Doctora?
Okay, so yung first myth, hindi totoo yun. Because no two autistics are alike. No? Each have their own qualities and then each have their own characteristics. However, they have to follow talaga yung tatlong diagnostic criteria. They have delayed language, they have delayed social interaction, but sa repetitive interest, iba-iba na sila.
Plus, yung si Dustin Hoffman, it's more of parang Asperger.
Yes, and more of yung tinatawagan nating savant skills. Okay, so i-mention na rin natin yung savant skills. Some autistics kasi are non-verbal, but they have these savant skills. Ito yung parang talents nila na extraordinary.
Musikero, ganyan.
Oo, they have very good memory for numbers. No, yung sabi nga natin earlier, during the break, pinag-uusapan namin ni Doktora, yung they memorize plate numbers. Okay, and then some would memorize the calendar. They have calendar minds. If you say May 1, 2008, anong day yon? Sasabihin niya Tuesday. Okay, so parang
photographic memory.
Photographic. Okay, and then meron din silang mga parang interest for religion. Meron akong patient, no, magaling siya sa mga verses.
Yes.
Bible
And then
verses.
ang ano rin, alam niya yung pages sa Bible. So very ano talaga.
It's something na extraordinary. Hindi naman yung magaling lang eh. Kasi parang ibang klase ang pagiging magaling nila in that field. No?
Again, mystery.
At saka, focus din sa isang bagay.
Yes, oo. Very focused sila dun sa particular topic na yun.
Yes.
No? Talagang yung obsession nila
Doon
is
lang.
very much into that activity or certain particular topics.
Pero doktora, naniniwala ka doon sa namamatanda lang o nanuno dito sa amin? Kasi kung minsan pag may diferensya yung bata, may nuno yan, are.
Oo nga,
Sasabihin nila yan, o
Exactly,
namatanda
no?
yan.
Palaging isa yan sa mga questions sa
So,
mga
kailangan
matatanda.
patawas yung bata.
O kailangan daw mag-second opinion sa
Huwag mo nang
albularyo.
pa-injection na bago dalhin sa doktor, ganyan.
Oo nga
Papatawas
eh.
muna nila.
Ipapatawas
Oo.
muna. So,
Which is okay if they want to do it, di ba?
Oo, in our culture kasi, we're a very democratic country, pwede. Pero again, don't forget to go back dun sa ating evidence-based studies and evidence-based approach in dealing with these children with autism.
Pwede bang maging productive yan? Is that the reason why people like you, na nasa ganyan field, you're doing this, you're working so hard because something can be done for them.
Yes.
Makapag-asawa sila, meron silang talent na pakikinabangan, ganyan.
Yes, Sunny, no, depending on the cognitive and or intellectual functioning of the child. If this child has really average IQ, no, they can really go into a normal life. No? They could go to regular schools.
They
They
can
could
marry.
be hired in a work area. They can marry. Okay? Pero itong nagme-marry, ito yung mga children later on diagnosed to have Asperger.
Yun.
Okay? Yung binensyon natin kanina, Asperger syndrome. Sila yung mas may malalaking chance to go into social relationships. So when we talk of social relationships, again, pwede bang ang isang autistic ay merong emotions, may feelings? So meron naman, no? Kaya lang
Sobrang
it's very
sensitive ba yan?
limited. They could be very sensitive, no? And then some would be having fears, anxieties. Meron yan silang mga predisposition.
O yung
Some
anger, yung sobrang
psychiatric
galit naman.
Violence.
Ganyan. Violence.
So, pwede ba
So
sila
ito rin
maging
yung
violent?
maglilid sa kanila to go into violent acts. Kasi some of the Asperger syndrome, meron silang comorbid. Bipolar disorders, anxiety disorders, o kaya depression.
Yes.
Yung sa sobrang high expectations nila sa sarili nila or some expectations from other people, hindi nila nakuha. They resort to violent acts.
So it's more of the Asperger's na nagiging violent. Sabi nga nila, autistic or not violent type, di ba? So,
Yes.
yung speaking of violence, so we just want to mention, I think yung dun sa...
Newtown Massacre.
So, even
sa
yung
school.
dun sa Colorado, yung dun sa theater,
Yes.
sa US, yung for this year, that's just last year and this year lang na violence sa school and sa theater na yung bata,
Oh, yes.
pinagbabaril niya yung mga tao. So, they are actually diagnosed as having Asperger's disease.
The more important, when you see that the red flag na kaya dapat dalhin talaga sa
Yes.
sa mga professionals sa mukha niyo.
Oo, tsaka kailangan din, ang i-emphasize ko dito sa mga diagnosed to have Asperger's syndrome, the developmental pediatrician should be able to screen for a comorbid, no, psychiatric illnesses. Kasi hindi pwedeng kami lang. Once we see na, ay parang merong anxiety disorders,
Yes.
merong depression or bipolar, merong mood swings, i-refer na sa child psychiatrist. So there must be a team, no? Parang ito, merong on-board na psychiatrist. Kasi
Where do the parents come in? Do they come into the team?
yes,
You're talking about the medical...
The medical side is yung tayo,
Kayo?
no? Tayo, doktora. Pero yung parents,
Yes.
they should be also open to this suggestions na kailangan mag-consult din sila sa psychiatrist. But kasi some of the parents will parang regret, no, seeing a psychiatrist kasi sabi nila mentally walang problem ang anak nila. Pero kasi it's the way we explain it to them. Na ito kailangan magbigay ka ng data, no, na itong mga batang to are prone. And then again, going back to Doctora's question a while ago, not all Asperger's naman, no, will
Are
have violent acts. Pwede rin ang mga low func. Meron ding mga low functioning, no, like in Central Luzon, recently meron tayong isang bata na diagnosed with autism pero low functioning siya, sinunog niya yung bahay, no? So parang meron din, no, mataas pa rin yung kasi they do not know the safety issues eh. They just play with the match, they play with akala
Kaya it's
nila.
important talaga na the parents should have acceptance.
Oo.
Kasi once you have acceptance, everybody will be aware. So
Tama.
alam mo yun, hindi ka na in denial na pababayaan mo na lang siyang gawin kung ano yung gusto niyang gawin. So even the people around will be more sensitive.
Tama.
Diba? So siguro
Pati yung mga kaibigan, yung community pala merong role, no?
Diba kasi yung mga kamag-anak na offend, kamukha, yung may kinukwento ka, tinulak ka.
Oo.
Kasi hindi naman nila alam na gano'n. So
Hindi ko-
kung alam nila,
Oo.
mas magiging sensitive yung mga tao
Right.
around them.
So, talagang lahat tulong-tulong talaga, doktora, no?
Yes, it's a really multidisciplinary
Multidisciplinary.
team, no? With the family, and then yung doctors, and then yung community.
Kasi yung ibang nasa komunidad, lalong inaasar pa, di ba? Which is, I think, the wrong
Yes.
thing to do. Lalong, they push them to be, para lalong mawala.
Lalo sa States, kaya nga siguro talaga mataas ang rates nila na may mga massacre na gano'n. Kasi very high ang bullying sa school. Luckily sa Pilipino, mas tolerant pa rin ang mga Pilipino sa ganito. So
Right.
hindi pa rin gano'n kataas ang bullying sa school. Although meron na rin, pero if you hear stories abroad sa US lalo na, ibang pangbubuli ng mga Caucasians yata.
Yes, so
Okay, so,
I think we can go to the
yung treatment,
paano
no?
paano ba sila gagamutin? May gamot pa ba o wala na silang pag-asa?
at uulitin natin yung first 3 years, no? Importante.
yes.
Sa,
Yun pa rin yung emphasize natin, the first 3 years of life, no, yung red flag signs, and then yung early intervention.
early intervention. Hindi pinapabayaan yan, no?
Yes.
Hindi pwedeng pabayaan yan.
Ano ba yung early intervention?
Oo.
What's the
Sinabi,
earliest intervention na pwede mong
Early
gawin?
intervention program, when we say early intervention, so it means na maaga natin silang dinadala sa therapy. Okay? And when we say therapy, it consists of the non-medical therapy. No? Ito yung mga treatment options, like we bring the child to the occupational therapist. Ano ba yung occupational therapist? They do the behavior modification techniques para yung bata
Hindi medication yan.
masyadong-
Walang gamot-gamot muna
walang
dyan.
gamot.
Okay.
Non-medical muna tayo.
Okay.
And then yung dinadala sila doon para mas mag-focus, mag-improve ang eye contact, and then yung kanilang fine motor skills. And then later on, if they have very good attention skills, they could already start speech therapy sessions. And then some kids, mga 3 years old, they could go to an early schooling. Some would have a SPED program, yung special education program, one-on-one therapy with the child. And then kung magaling ang bata, even diagnosed with autism, pwede siya sa regular preschool. Okay? So for the medical treatment naman, this is reserved for children 5 years old and above. Pero itong mga autistic na needing medicine, yung mga batang extremely hyperactive, yung merong sleep irregularities, and then yung merong self-injurious behaviors, o what we call yung mga aggression sa sarili nila,
Suicidal?
and then to other people.
Can you say
aggression?
aggression?
Yes. So yung suicidal, some adolescents with autistic features,
Doon na
with
nagmamanifest
autism, nagmamanifest din yan.
Okay.
Some would say na I'll kill myself. So pag ganyan, again, merong child psychiatrist on board.
So you see, kapag nagpunta ka, you seek consult and you ask for help, sometimes parents, sinasarili lang nila or sa family nila na hindi natutulog yung bata. Hanggang madaling araw gising. Tapos nagwawala. But if you seek consult and you ask for help, these things will change. So yung function, para maging functional sila, not only yung sa society, secondary, sa bahay pa lang, malaking tulong ng nagpatingin at nagpa-consult at para mabigyan sila ng proper therapy. Diba?
Do they have to be in a center? You have a center, right? Do they have to be there? Do they have to stay there?
Ideally, they should be in a center, consisting of parang multiple interventions. Okay, so here in Central Luzon, we have just recently put up a center. It's an intervention center consisting of people, with skills,
Yes.
in dealing with these children with special needs. So meron kaming occupational therapist, speech therapist, reading remediation program, and then we also have the pre-vocational program. Ang pre-vocational program for those children na mga teenagers na, they turn out to be parang mga teens na, pero tuturuan mo na sila nung pang-araw-araw, na gawain sa bahay. Pero ito yung mga non-verbal autistics.
Yes.
Meron ding mga verbal, pero they will have to be taught how to live independently. So parang mini bahay ni Kuya na meron silang time to cook, time
So how
to
long do they
fix
stay?
So ideally, kung sa States yan, ideally talaga 25 hours a week. Pero sa ating setting, kasi wala tayong insurance, so we just limit it to 1 hour a day.
1 hour a day.
7
Yes,
days a week.
so 6 days, Doktora, kasi wala
Magpapahinga
namang
ka
Magpapahinga.
Sunday. Pero, so just 1 hour, they just stay there for 1
1
hour.
hour. So
Hindi
they
yun
will be
talaga,
taught.
hindi siya pwedeng parang daycare na they can
Hindi
do.
Actually, yun ang question din ng mga parents, lalo na doon sa transition. Pwede ba silang i-admit? Parang
Yes.
doon na lang muna sila. So, mukhang
Not yet.
Malayo pa yung ating...
And it's not a school.
It's not a school.
It's not a
Yes.
school.
It's not a school. Again, I will have to reiterate, it's an intervention center. It's more of a combination of the therapy sessions. Hindi siya yung what we think of as a SPED school. So multiple.
But here in, here in Angeles, we have, do we have a special
In
school?
Angeles, we have several special schools. They offer also special education programs. We have handprints.
Yours is in San Fernando, right?
Oo, yung amin ay nasa San Fernando.
Pero sabi mo nga, di lang kayo mga doktor doon,
So,
multidisciplinary.
ilan ba kayong neurodevelopmental pedia in Central Luzon?
Actually, I'm the only one in Central Luzon.
Oo nga.
Pero we just recently trained fellow. So ngayon pa lang siya papasok. Pero she will be in charge of the Subic area. So,
But why are...
dalawa na kami.
Bakit ang
Sila,
ko-continue?
hindi.
Bakit ang ko-continue?
Actually, marami
Part ba ng
kami.
denial na kultura natin itong...
Actually, marami kami. Kaya lang yung programs kasi na nag-o-offer nung training are only 2 hospitals. Yung PGH,
Yes.
and then yung Philippine Children's Medical Center, PCMC,
So,
where I graduated.
again, we're very lucky,
Oo.
Angeles, to have
Oo.
to have neurodevelopmental ped
Oo.
within our reach. Nandito na po siya.
Pero ulitin
thank
natin,
you.
dapat sa pedyang ordinaryo muna yan, di ba?
Yes. Oo, important pa rin talaga
Oo.
yung roles no ng mga general pediatrician.
Tsaka hindi physical yung problema, made-determine before dadalhin
It's
sa inyo.
more of the behavioral,
Behavioral,
and then the delays in the milestones, particularly the language and the socials.
Kaya naman ba ng ordinaryong Pinoy yan?
Yes, kayang-kaya.
Oo,
Kayang-kaya
kasi
ng
yung iba
Pinoy.
gusto, hindi kayang di ba?
Basta
Gastos.
Pinoy, kayang-kaya.
Pero hindi yan covered ng insurance, sabi mo.
Yes, walang wala kaming mga HMO, wala pang card.
Dapat yung PhilHealth, inaaral na rin yan, di ba? Nag-expand
Oo,
na rin
isa
sila ng
siguro
coverage
yun
nila
sa
eh.
Pwede nilang ang PhilHealth.
Kasi merong isang NBA player, si Royce White of the Houston Rockets. Hindi siya makapaglaro kasi sabi niya yung iba na-i-injure, napipilayan. Hindi sila makalaro. Ako, mental yung problema ko kanya.
Pero nakaka-
So dapat ganun, meron din na kaming special na pahinga, ganyan. Hindi makasakay, may anxiety disorder, hindi pwede sa aeroplano, ganyan. It's now a current thing that they are discussing. Anyway, hindi pwede yung gamot sa yung
We forgot
albularyo.
to mention- pero hindi. I think it's good also to mention, no, na diet. I think you need to parang change yung diet kasi parang lalo na kung medyo hyperactive yung bata,
Sugar,
kung
chocolates.
pupunta lang din sila sa mga pediatricians nila, you will teach them how to ano yung food na dapat iniiwasan. And sa States, uso sa kanila yung gluten-free diet. Pero dito, we cannot do that, no? Pero as much as possible, like yung chocolates lang,
puro kanin.
soft drinks lang, di ba?
Even
Pwede
yung
ba
kanin,
yun,
maraming
Doctora?
sugar.
Although,
Yung caffeinated.
Doctora, it's not really evidence-based na kailangan we avoid sweets or caffeine-rich food. Pero ako I usually advise
Iniiwasan mo na.
my patients, no?
Especially
na
kung
you
may
have
sleep
to
disorders,
give it in moderation. That's very important nga, Doktora, yung diet. No? Pahabol lang, no? Lalo na yung mga nutritional status ng mga autistics because of their sensory problems. Some of them will not eat rice. Some will be picky eaters. Yung iba ang kakainin ng biscuits. Yung iba pizza. Yun lang ang talagang food nila. So wala silang
So,
ibang
breakfast,
kakainin.
lunch, and dinner pizza.
So, yun talaga. Kailangan natin talagang emphasize yung early intervention. Kasi ang mag-manage nitong mga sensory issues, yung occupational therapist.
Hindi ba indication din yung sabi nila you cannot touch them or some of them they want to be touched, so yung a lot of hugging and everything.
Yan pa rin yung mga sensory issues nila. They're very sensitive to touch. And then some would be hyposensitive naman. Parang ayaw naman nila magpaya.
Like the guy in Newtown.
Yes, that's the reason why na agitate siya. Because he refused to be touched. So, important din yun, kailangan i-address din natin ang mga sensory issues kasi it will impair their learning styles din.
So, ma'am, ito yung acceptance, yung pagtanggal sa pagde-deny ng condition ng bata, importante.
Important po yun. And then, we could walk through the process naman, no, na parang to accept the disorder.
Hindi dapat kinukulong yun sa bahay.
Oo, hindi dapat
Tatago
ikulong.
na lang.
Tatago.
Dapat the more po kayong maging proud, no? Na kasi even if you have this child with autism, meron siyang mga nagagawa na hindi kayang gawin ng ordinary child. So you have also to focus to the strengths. No? Kailangan i-ano mo rin, not only the weaknesses.
Hanapin mo yung strengths nila.
Hanapin mo, no? Bakit siya kaya ganito? Bakit kaya niyang gawin ito? And then, pwede siyang mag-bloom into someone na extraordinary.
Yes. You know of some personalities in present day world na may problemang ganito?
Ang pinaka talagang lagi ko sinasabi sa lecture, famous people, Einstein. No? Einstein is one. And then, ang sabi nga nila si Bill Gates. No? As
So, hindi lang naman puro yung mga infamous. So, meron din mga very
Real productive, ha?
yes, yung naging functional sa society talaga, no? They can really excel.
And the
Actually.
movies, no? Yung ating mga napanood, yung Rain Man,
Yes.
as mentioned earlier, yung Forrest Gump. And then we also have one recent
Puro running naman ang
movie.
ginawa nun, no?
Oo. Yung Adam, no? Adam is a story about an adult with Asperger's syndrome. So magandang ano rin yun.
Magandang panoorin din. So they have
Panoorin.
some understanding of
Yes.
of what autism is all about. No? Okay. Yung mystery, sabi mo, yung mystery kasi, naano rin ako, gusto kong, tinanong ko yung nanununo na namamatanda. Yung iba naman daw, anak ng alien, gano'n. Naririnig nyo siguro yan.
Mystery
So,
kasi hanggang
oh,
ngayon, hindi pa rin
diba?
talaga nila ma-identify.
And also,
Nakakahiyaman
ano,
tanong, pero kung minsan,
mystery rin, Doktora, kasi some of the kids, no, dahil nga mysterious, at a particular time, mga 10 years old, 11 years old, dati silang hindi nagsasalita.
Biglang
Mm.
magsasalita.
Biglang nagsasalita.
yes.
Na parang ganun din naman yung therapy, walang
Mm.
nagbago. Pero bakit nung time na yun, ang tagal?
Oo.
Very
So,
unique, no?
Mysterious
Each
talaga yung
individual.
ano ng brain din. No?
Mhm.
How the brain works. Ano kayang nangyayari no, sa utak ng mga batang to? Bakit biglang nagsalita?
Mhm.
Okay, meron naman 18 years old, doon pa lang din siya nagsalita.
Oo.
No? So, it's really a mystery.
O yung late bloomers, ganyan. Parte ba yan? Yung mga
Yung
pag
mga
may,
late
pag may
bloomers,
edad, oo.
pwedeng itong mga late bloomers na to,
Mhm.
no, diagnosed pala no,
Mhm.
as Asperger's. Kasi sabi ni late bloomer, late nag-date,
Mhm.
no, late silang nakisocialize. Pwede.
Yes.
Pwede.
Mhm.
Kaya ang dami ring undiagnosed. No? Minsan sa ating mga workplace, meron
Yes.
tayong mga kasama na
Oo.
parang hindi nakiki-interact, hindi
Oo.
nakikisali. Pag ang topic about showbiz, ayaw.
Mhm.
Kasi mas gusto niya, prefer niya topic about computers.
Mhm.
No? O kaya yung mga movies na mas weird. No?
Mhm.
Yun.
Ano yung sa kabayo? Parang nakaano sila? Yung di ba may
Nakatakip yung sides
Oo.
nila. So, isang direction
lang-
lang.
isang
ang
direction lang
pinapanood.
yung-
Parang barrier.
Mhm.
No, actually, yun yung talagang magandang analogy. No, parang they're very rigid.
Mhm.
They have this one track lang na pag ito lang.
Mhm.
At hindi mo ako pwedeng disturb. Hindi mo pwedeng you cannot step on my personal space.
Mhm.
And it's one of my parang anxiety.
O yung sobrang linis, di ba? Yung ano ba yung tawag ba?
Obsessive
Obsessive
compulsive.
Oo, yun.
Actually,
So,
parang
Huwag niyong gagalawin yan,
overlapping.
yung-
Alam mo, kung
Oo,
isipin mo
oo.
naman talaga lahat ang mga characteristics ng mga tao, meron makikita
Traits.
isang traits na mali sa'yo or
Mhm.
na may psychiatric problem. Kaso nga lang, when it exceeds na
Yes.
yung function mo
Pervasive
sa...
siya.
Oo, tapos yung naapektuhan ng everyday life mo, doon na yung nagiging, na madadiagnose ka na iba na.
Yung kumakain ka,
Nagiging sakit
nilinis
na siya.
yung
Yes.
table.
So lahat yan, mapapansin mo lahat
Mm.
tayo meron. Pero
Mm.
pagka sumusobra, dun sila na pwede nang i-diagnose.
Mhm. So, once you see yung sinasabi yung mga palatandaan, di ba? You go to seek professional help na kagad.
It's very important to seek really professional help,
Yes.
especially to those professionals
Mhm.
who are really experts.
Yung albularyo, wag na muna sa
Oo,
albularyo.
yung albularyo, second opinion.
Oh, second opinion. O kaya first opinion yan.
Sila first opinion, tayo pala nga second
Sa
opinion.
kultura natin, first opinion yan, ha?
Oo, first opinion sila.
Oh, Doctor, we have a few minutes. Now. This is a very interesting discussion.
Okay.
What do you want to tell our audience in Central Luzon?
Okay, for
Una,
our...
palagi ko you have to discuss kung saan ka matatagpuan.
Okay. So, you can reach me in a lot of centers in Central Luzon. Actually, I have 2 clinics, one in Angeles University Foundation Medical Center every Mondays, 9 o'clock to 4 p.m. By appointment. And then at San Fernando, in our new intervention center, it's near Coke, Baliti,
Mhm.
every Tuesdays and Fridays. Whole day by appointment. So for the contact numbers, maybe
Yes. We'll have
we
them
can
on the screen.
flash it in the screen. And then every Saturdays, if some parents are very busy, you can also see me at St. Luke's Medical Center, Neurodevelopmental Center.
Dami mo palang no?
They say nga all the developmental pediatricians are everywhere.
Oo.
Kahit na konti kami, pero kulang pa rin yung
Oo.
yung
Marami na may tama talaga ngayon. Pero hanggang 18 ka lang, di ba?
hanggang 18.
Hanggang 18. Mhm.
Because ang strictly ang pediatrics.
Pero
up to
sabi mo nga,
18
but
years
special
old.
cases,
Oo.
kung simula bata, hawak na niya.
Oo.
Oo,
Baka.
pwede pa rin namin silang
Baka.
i-handle, especially for those na meron pa rin mental age around 7 years old.
21 nga,
pero
7 naman.
21 years old ang chronological age niya. It's still an issue pa rin, no? Among the medical team kung kanino
Kanino siya pupunta?
kanino ang transition, no? Saan siya marirefer? Is it a psychiatrist, an adult neurologist, or probably a family physician? Kasi di ba very important din yung medical side. Hindi pwedeng walang
Sabi mo nga, multidisciplinary yung approach sa treatment, no? Sa intervention.
Lalo na marami na silang problems later. Yung mga illnesses nila.
Okay. Thank you very much. No? Doktora, baka meron ka pang gustong idagdag, ha?
Yeah. So,
Pero ngayon ko lang na kaya pala yung mga nagbubuntis dapat pala alagang-alaga rin, di ba?
kaya nga sabi ko sa iyo, ang role ng obstetrician, it's from really conception. So, talagang kami, lahat yan, kasama kami. We're part of it. So, very important na nagbubuntis pa lang sila. Plano pa lang nilang magbuntis. You go to your obstetricians, you discuss it with your doctor. Paplanuhin nyo. Mas maganda kung pinaplano talaga. So, sobrang swerte lang tayo na si Doktora. We've been wanting to do this last year pa. Kasi si Doktora sobrang busy. Pero luckily for us, pinagbigyan niya tayo na maging guest natin siya. No? So, sa inyo pong nasa bahay, ulitin namin, 1 in 88 children po has been identified with an autism. So, kung meron po kayong anak, kamag-anak na merong, sa tingin ninyo, merong kakaiba, huwag po kayong mahiya o matakot na dalhin sa inyong pediatrician or sa inyong kahit na family physician nyo, basta sa doktor, para po madirect nila kayo kung anong dapat ninyong gawin. Hindi po kayo nag-iisa. At isa pa, marami pa pong ibang tao na sumikat, na magaling, na naging functional, na nakatulong sa society nila. Kahit may mga ganitong sakit sila. So, just acceptance pa rin.
Acceptance.
Huwag niyo po silang itago.
Okay. Anong special trait ng kagaya mo, Doktora?
Special treat?
Yung special trait nyo. Kasi mga bata, may iba-iba yung ugali, ganyan. Dapat siguro matyaga ka,
Siguro
no? Patient.
Patience, and then yung we have really to exercise empathy. Kasi sometimes, no, sa sobrang busy rin ng mga developmental pediatricians, pagod na kami, minsan akala ng parents, ganun-ganun lang ang pagkasabi na ang anak mo ay may autism. Pero it's not it, no? Parang na-feel pa rin namin yung burden na mararamdaman nyo, but we have to tell it to you. Kasi kung hindi
how do you do it?
sasabihin,
How do you do it?
diba?
It must be something special also.
Actually, when I say it to them, sabi nga nila, break it to me gently. Pero within that hour, kailangan ko sabihin. I still start from the differential diagnosis. So, kung ang bata ay language delay, pero maganda ang social interaction, so at least okay tayo.
Hindi mo sila sinasara ng pinto. Hindi mo sila sinasara yung hope na, there's always the glimmer of hope,
yes.
no?
Palaging yung dyan, merong hope. Actually, hope is the word. The word, no? Na parang kailangan hindi tayo mawala ng pag-asa. Na kung ano siya ngayon, kahit mabagal ang mga progress, there's really a chance that they will really improve. And some nga, sabi nila, they have recovered already from autism. Kasi parang normal na talaga sila. Hindi mo na mapapansin, no? Through the years.
Mas importante, yun nga, sabi mo, walang denial, recognition, and then go and seek professional help. Yun pong masasabi ko, yun ang madadagdag ko, huwag niyo hong itago. Kasi pag tinago niyan, sinasayang niyo na yung buhay. Sinasayang niyo na yung bata. Malay natin, maging Einstein yan, maging si Bill Gates, no? Si Raul, ganyan. Basta importante ho, tulong-tulong. Pinaka-importante yung narinig ko kay Doktora, it's everybody working together to find a solution to the problem of the child, no? Yung magulang, especially yung mga professionals, mga doctors, no? Pati yung community ho. Huwag natin binabastos ho, lalong-lalo na sa school, no? Yung special understanding of, sabi mo, pwede naman kung mag-aaral sa ordinary school, right?
Yes. Yung acceptance,
acceptance,
that they belong,
right.
They belong to the group.
Tama. So, yun ho tandaan natin. Tandaan ho natin. Autism Week ho ngayon, didiscuss namin to, pero ito hong hindi ko naghahanap ng panahon nito. Ito ay everyday. It's an occurrence to a lot of people. So let's do something about it. And something can be done about it. Maraming salamat po. Ito po yung lingkod, Sunny Lopez, sa inyong programang Action Central Luzon Special Edition, and you have a nice day now.